want you to keep your legs down, and I want you to actually just try to arc up and lean on your elbows, okay? Yeah, just like that, come on up. Any discomfort with that position there? No? Okay. So this is actually the last progression of the Mackenzie exercise. Most people, if they're in acute pain, they can't really maintain this position, but Kanav, you can do it right off the back. Thin for me, and then all the way out, Good, good, and relax. Oh. Love it. And there you go, hold right there. So breath in, and all the way out fast, all the way out, good. Nice, okay, so 2 very solid low back releases. Kanav, good to see you again,
Dr. Adam.
It's been a minute. Kanav was a patient who I first met at a previous clinic that I used to work at. He just gave me a call last week. Seems like what we were dealing with beforehand has flared back up. I'm going to let him talk about it a little bit. So why don't you kind of tell us what's going on?
So I visited Dr. Adam the first time in 2022 January. No, actually 2023 January.
2023.
I had acute lower back pain, and I have been a really outgoing person, so that was kind of hurdling a lot of things for me. So I heard about Dr. Adam through one of my references, and I went over here, and I think I got around 2 months of lesson or 1.5 months of the chiropractic treatment. For the next 6 months, I had literally, it was amazing. And now here I am back again because I think that the problem is coming back again.
Yeah. Mm-hmm. So I can't remember exactly what it was we're dealing with. We're going to figure it out today because we're going to do a full re-examination. But Kanav has responded positively in the past, so feeling pretty confident about getting him feeling better again. But why don't you tell us right now exactly what's going on? Like, you got that lower back, I remember it was lower back.
So first of all, that my lower back is always, there is some sensation, there is always something going on. It's never out of my mind that my lower back has nothing to do with it, right? The second thing is that I have bought you some results from my MRI.
We'll take a look at that.
Yeah, but I think that if I'm walking all the time, if I'm being active, I can feel something in my back, but it's not paining.
Okay.
But once I'm resting, it's just paining a lot.
Okay, do you get any pain down either of the legs?
To be very honest with you, I started to get a lot of pain 1 month ago on my legs, but it kind of because of I was started to do swimming and exercising, so it kind of went down, and now I have like till my lower thigh.
Okay, so to the lower thigh, but we're not getting it all the way down into the foot.
Doctor, what kind of pain it is when it goes to the foot? Like tingling, itching, like
well,
stuff
okay,
like that?
yeah, no, I'm interested that you said tingling. Yeah, so I'm talking about like it might be a shooting or a burning pain or a tingling numbness sensation. Have you ever heard the term sciatic? I'm not sure if you explained sciatic pain to you beforehand. But yeah, anything like that would travel down the entirety of the back of the leg towards the foot, or are we kind of limited at that hamstring?
I think I'm kind of limited over here, but I do feel something going on some of the times if I do concentrate. But I don't think that this part isn't getting affected at all. Right?
That's good. Now, in cases of true sciatic nerve involvement, we will see that kind of tingling or burning sensation that go all the way down into the foot. So it's good that we're kind of capping at the hamstring there. It tells me it might be more of a muscular imbalance problem rather than a disc injury or a nerve involvement type issue. So that's a good thing. Okay, that's a really good thing. We'll take a look at the reports off camera, and anything else to report about it? It's on your right side. Yeah? Or left side.
Since last couple of weeks, I have started to feel the same thing, but on the very initial stage on my left side of the thing.
Okay.
Maybe because I'm putting a lot of pressure due to my active work style.
Correct.
But yeah.
Yeah, compensation is a very common thing in cases of injury. Very often a patient will come and be like, oh, my pain was all on one side and now it's shifted to the other side. What's going on? I'm getting worse. No, probably not. It's probably all just compensatory changes. And yeah, if you're moving ineffectively on putting that all on one side, you're gonna eventually get sore on that side. That's just a matter of time. So likely that's what's going on. We're still gonna figure it out. Anything else to report about the complaints?
Apart from that, no.
No? All right. Sorry, remind me one more time when it started coming back on, and was there a movement that you did? Or?
To be very honest with you guys,
that's okay.
My insurance got expired, so that's why I kind of discontinued with you.
No, that's totally fine. Totally fine.
And probably after 3-4 months, it started again.
Okay, and it just crept back up. It wasn't like you did one movement and everything.
It started slowly, very gradually, and then in probably November and December, it was at the peak. Then that's when I met my family doctor, and they gave me some painkillers to relieve inflammatory medicines to relieve my back pain. But yes.
Okay, yeah. So again, anti-inflammatories, muscle relaxants, great. They will help with your symptoms in the moment, absolutely, provided you have either a muscle spasm or an inflammatory complaint. But if you're dealing with a mechanical, not necessarily structural, but a functional, a way you move type issue, taking a pill is not going to fix that. Period. It's not going to fix that. It's only going to address the symptoms. So that's why it's good to see a physio or a chiro or a sports massage therapist, stuff like that. But what we're going to do for today is we're going to do a physical exam. Okay, we're going to figure out what's going on, and we're going to treat you. Okay, that sound good?
Perfect.
Awesome. Anytime we are thinking we might be dealing with disc involvement, it's always good form to do a full neuro exam, because if we do get impingement on that nerve, we will get, well, resulting neurological effects. So I need you to slide a little bit further back, actually. Perfect, just that your feet are dangling. I'll move the mic there. Now, he's got long legs, so this makes this harder to do, but we're still going to manage. All right, just relax as best you can. That's good. That's good too, okay. And sorry, remind me, it's the right side primarily, right? All right. Relax this foot as best you can. Good. As best you can. Good. Get you to push this leg up into me as hard as you can. No, into the hand, into the hand.
Oh, sorry, what?
Kick the leg up into my hand. Push. Okay, you don't have to push that quickly. Just hard press it. There we go. That's good. Lift the toe up. Good. Push up. Good. Thank you for not kicking the expensive microphone. And push up. Nice. Awesome. So that is a normal lower limb neuro. We might have a disc involvement, but it shouldn't be compressing on any nerves that greatly if we're not seeing any irregularities with the neurological exam. So that's a good sign for Kanav. All right, Kanav, I'm going to get you to stand up for me actually to get started here. And first things first, I want you to try to bend down, touch your toes. Let me know if that provokes any of the discomfort that you're dealing with in the low back, okay? If it does, you can stop. You don't need to go the whole way. So right there,
right here.
All right, we are not able to get that much flexion in Kanav, but let's check out the extension. We need you to bend backward now the other way, see if that provokes any discomfort. That's okay?
Not at all.
He can go very far with that, so extension's totally fine, but we are limited in that flexion movement, which does point us again a little bit in the direction of potential disc involvement. I'll get you to have a seat for me. Anytime we have an issue with one area, it's always good form to check above and below that. So we'll check the below later, the SI joints later, but I'm going to get you to give yourself a tight hug, really tight hug. And I want you to rotate as far as you can to the left for me. Any discomfort in the low back with that, and rotate as far as you can to the right. Any discomfort in the low back with that. Okay, that's all good. Perfect. It's the right side primarily that's bothering you, so we're going to start with the left. We're going to start with that straight leg raise, keeping the knee straight. We're going to lift this straight up as far as we'll go. Any symptoms down this leg or into the other one, or the back? No? Awesome. Now I want you to slowly lower this down yourself. Slowly. Any discomfort in the low back with that? No? Awesome. All right. Now we're going to lift this straight up. Any discomfort in the back or the leg with this? We're going to keep going.
Now stretch way on the
hamstring.
And even towards the bottom of the knee.
Further.
But no, not that much.
Okay.
Just over here, right now.
We're going to go a little bit further.
No problem.
Okay? That's still okay?
It is, but now it's on my calf.
Now it's in the calf. Okay, if I were to pull the toes down, okay, what'd you get? What happened?
Down the calf.
Down the calf.
Yeah.
Okay, all right. So with that, we're looking at a positive right-sided straight leg raise, as well as a positive what's referred to as Braggart's test. That's when I bent the toes there, which indicates we've got some kind of nerve root tension along the chain. We do have nerve involvement, but it doesn't seem like it's progressed to the point of affecting either his motor strength or his deep tendon reflexes yet, which is a really good sign that he's in early. We can get it under control. We're going to test out the SIs. So for that, I'm going to get you to bend this knee. I'm going to bring your hip over here. My hand's going to go behind your very long femur and pushing through. That's okay?
Yeah.
Okay.
I can feel a little bit something, but it's okay.
On that side?
Very, very mild over here. That my bones clicking.
Okay.
Very little.
Could be that's the compensation that we're getting due to the symptoms on this side. We got a little bit of SI irritation on that side. Let's check out the SI on the right side. I'm going to bring this over, place the hand here, and push through. That's okay?
Nothing at all.
Perfect. Okay. You can do a hip screen. That's okay, bringing that up.
Nothing at all.
Love it. And
nothing at all.
perfect. Bring this up. That's okay. Excuse me. Yeah, that's
No
okay.
problem.
No hip issues
No problem.
to report. Good, good. Awesome. All right, my hands are coming in on your back now, okay? So, low back. Again, we're dealing primarily with a right-sided complaint. So, pressing through that left SI, that's okay. Yes?
Yeah.
Okay.
Yeah, no
Now we're going to press through that right SI. Any discomfort there?
Like 5%.
5%. Okay, so a little bit of something. As we kind of creep upward, how's when I press in through this region?
Nothing.
Nothing. Okay. Are you okay if I share the results of the MRI report with the camera?
Absolutely.
Okay, so I did take a read through the MRI report that Kanav provided here, and it looks like we've got, I believe it's an L4, L5 partial disc protrusion or herniation with some sort of nerve involvement. So that will explain why when we tense up the nerve root with that straight leg raise, with that Bragger's test, we do get aggravation of symptoms. However, I've seen a whole range of disc injuries. Okay, I've seen some that are so bad, all I have to do is press in here and everything lights up right down the chain.
Really?
Okay, yeah. So in your case, I think what you've got, you probably have a mild degree of that disc involvement that we managed to get under control last time, and for whatever reason flared back up. Okay, so I don't think this is something you need to be super stressed out about, but we're still going to handle it all the same, because as far as disc herniations go, yours would be quite mild. Okay. Are you ticklish up there? Or are you just tight? Okay.
Yeah.
Promise I'm not trying to tickle you, man. So, Kanav, I think you also mentioned that there was a doc who said you should probably get surgery for this.
Just because I had some family doctors and everyone.
Yeah.
So I decided to take a second opinion. I contacted a doctor, and they told me that you should get a injection that goes all the way into the spines and releases the nerve. So for a couple of years you have no pain. And they also told me that the final solution for this is a surgery to kind of, take back the disc from the tunnel and release the nerve.
So this family doctor, this MD, suggested either a nerve block, which, yes, very effective at limiting pain because it's literally turning off the ability for that nerve to function. That's one thing. And then the doc also suggested but foresaw a potential discectomy, which is removal of the sequestered or the herniated part of the disc to release the actual mechanical pressure off of that nerve. Of the two, the surgery would be the one that actually addresses the problem by removing the issue itself. But it's up to you whether or not you want to go the surgical route for this. I think only 5% of disc injuries actually end up going that route because they do not self-resolve. Now, the average, we'll call it lifespan, or the average period of time that disc injuries will last for is usually between 3 to 6 months on flare-up. So what that means is that even if you did absolutely nothing, it should improve itself. Kanav, you look kind of shocked at that. So that's good news for you there. What we can do in here, obviously, is we can help facilitate that healing process. Okay? You comfortable like that?
100%.
So here's what we're going to do, actually. Now that you're in this position, one thing that is effective for resorption of discs, okay, or getting that disc material to return back into the spot where it's supposed to be, is something known as the McKenzie protocol. Okay. Now, you say you do yoga.
Yep.
Do you know what the cobra movement is?
No.
Cobra. Close. I want you to keep your legs down, and I want you to actually just try to arc up and lean on your elbows. Okay? Yeah, just like that. Just like that. Come on up. Any discomfort with that position
Not
there?
at all.
No? Okay. So this is actually the last progression of the McKenzie exercise. Most people, if they're in acute pain, they can't really maintain this position, but Kanav, you can do it right off the bat. Does that provoke anything in the low back? Didn't think it would, because on exam he was able to extend backwards and was completely fine with that. So what I'd actually want you to do is part of your rehab is going to be to maintain that extension position for 30 seconds for, we'll say maybe...
5 times?
Yeah, well, sure. We'll say 5. 5's a nice number. And I'd want you to do that twice a day every day.
All right.
Okay.
All right.
Holding it in this position creates a negative pressure within the normal disc spot that wants to be refilled or vacuumed back up into the correct position. So if we hold that for longer, we're facilitating that resorption process. That's going to be a big part of your rehab. Okay. Perfect. All right, we're going to set Kanav up for an adjustment here. We're going to put the hand there. We're going to bring this leg up. Good. Scooch the hips towards me if you don't mind. Thank you. And we're going to hold right there. Okay. Now we've done this before. I remember this. I'll get you to take a big breath in for me, and then all the way out. All the way out. Good. Good. And relax. Oh. Love it. That went really well, eh?
Yeah.
Felt good?
All good, sir.
Good. Let's get you on the other side. So again, we're going to bring this leg up. Scooch the hips towards me if you please. Thank you. And then relax up here for a minute. There you go. Hold right there. So breath in and all the way out fast. All the way out. Good. Nice. Okay, so 2 very solid low back releases on Kanav. Okay.
So, doctor, as you know that I love to work out and I do compound exercises with my body weight.
Okay.
I do love to do chin-ups, and when I'm doing chin-ups and at the end of my set, I like to just lose my body and just hold on to the bar, right?
Yep.
After like 5 to 7 seconds, I feel a tingling on the exact spot where there is a pain.
Okay. Tingling, does it feel good or bad?
Bad.
It feels
Like
bad,
I have
right?
to, I kind of have to take off my hands and come back to the floor.
Okay. So that's actually interesting to hear, because when you do have a disc issue, decompression of the spine can be a beneficial thing to do. So if you're doing what's referred to as a dead hang, which is kind of what it sounds like you're describing to me, where you're just hanging off the bar, if anything, that should actually feel good on the discs. But if that is aggravating your complaints, then I would obviously recommend to not be doing that thing.
Yeah.
A typical good rule of thumb to follow is, yes, first off, exercising with an injury, you can do that. Okay, nobody's telling you not to do that. But obviously you need to be wary about what's aggravating the complaint and what's improving the complaint. So my general rule of thumb is, if what you're doing is resulting in pain that is at a 3 or less, you can keep going. All right, at 3 or less, you're fine. But as soon as we get into that 4, 5, 6 or higher, God forbid, territory, you want to modify the activity. You want to discontinue it. You want to find something else to do. You don't want to push through that level of pain, because we could be re-aggravating and prolonging your recovery. Does that kind of make sense?
Absolutely.
So when you're doing your dead hangs, on a scale of 1 to 10, where is that tingling pain?
3.
Is that a 3?
Yeah.
Okay. Then you should be okay
Yeah.
to do it.
And
Obviously,
doctor, it happens. Sorry to cut you on that.
That's okay. That's
it
okay.
happens after my good 10 seconds dead hand. It's like where I'm trying to basically, just,
Well, keep an eye on it. So long as it stays at a 3, you're okay to keep doing that.
Okay.
Oh, we're ripping some paper.
I'm just gonna. I basically want to throw out my chewing gum. That's fine.
That's okay. Is this more tolerable than it was before?
You can do a little harder if you
Okay,
want. Yeah,
good.
yeah. This is okay.
Perfect. Ooh, tender in there, huh? Did you get anything down the leg with that?
Doctor, sorry. I feel like it's not tender. It's just my skin that is just kind of discomforting.
Just the skin is uncomfortable.
Yeah.
Okay, so here's what we'll do. We'll drop the tools and we'll just use hands. Okay.
Thank you, doctor.
No worries. Not everybody's going to respond the same way to different forms of treatment. That's why it's important to practice a diversified technique. When you have multiple different avenues to address one problem, you can do whatever the patient will respond best to. So in this case, Kanav, he doesn't like the tools very much. Totally understandable. We can use hands instead.
Sorry.
Yeah, you have nothing to be sorry for, man. Patient preference is one of the 3 pillars of patient-centered care, or is it evidence-based care? Either way, it's an important thing to consider.
Doctor, I have a question.
What's up?
Does maintaining body weight help with this disease?
Maintaining body weight. In what? Sorry, I don't understand the question.
Like if you get a little more fat or obese.
If you gain weight.
Yeah.
Okay. Will that make things better, worse, or the same?
Yeah, kind of. That's my question. What happens like if you're not active with your lifestyle?
So when it comes to disc protrusions or herniations and body weight, keep in mind that the discs exist between our vertebrae. Okay. And they serve essentially as quote unquote, this isn't technically true, but this is a way to describe it, shock absorbers within the spine. So as we get compressive forces that press down on our spine, on our vertebrae, the discs absorb a good chunk of that. Okay. Now, let's pretend that you suddenly packed on an extra 50 pounds. Okay. If that was the case, you get pulled down into the earth by gravity 50 pounds harder. Okay. Or whatever the equation is for gravity. Forgive me, I'm not a physicist. Okay. Now, with that extra 50 pounds and being pulled down greater, you will then naturally get more compressive forces in your spine, okay? Especially if you bend forward or backward to create a mechanical disadvantage, okay? So if you're getting more compressive forces through the vertebrae into the discs, you will potentially have a harder time resorbing that disc, and you're at a higher likelihood of pushing actually more material out or having a greater disc herniation.
Makes sense.
So, if anything, lighter people are at an advantage when it comes to recovering from disc herniations. How much so, I couldn't tell you. Okay, for that we need to dive into the research, figure out some systematic reviews, etc., etc. Okay, but as a general rule of thumb, weight loss can help with most forms of back pain, including disc-related issues. So I'm not telling you to go home and go do any crash diets. I'm just telling you maybe don't look to gain 50 pounds. Maybe cancel that dirty bulk if you were thinking about doing it. Right. So, yeah. Does that answer your question?
Absolutely. Good, absolutely.
Tender in here,
I wouldn't say. Doctor, it's my skin. Trust me on that.
You got sensitive skin,
Yes.
Okay. Is it better with my hands than the tools, though?
100%.
Good.
Though it is a little tender on the right. I can feel that.
I can feel that in your muscles up here. And breathe. Relax. There we go.
Doctor, can I ask you a question?
Of course. You can ask me as many questions as you like, Kanav.
Is this problem healable? Like, can we cure it?
Yes, absolutely. So we can recover from disc herniations, okay? And like I said, these things usually actually clear I think it's a 90% resolution rate within the first 3 to 6 months for most people, even with no intervention whatsoever. Okay, what we're doing here is going to help facilitate and speed that up. Now, the thing is, like, unfortunately, your insurance, your benefits ran out before we were able to get into the how do we keep this away phase. But what we'd be looking at doing is enhancing our core stability to provide more support to the lumbar spine. When the lumbar spine is supported properly, when it's able to properly absorb whatever forces we put through it, we're at a greatly decreased likelihood of getting re-aggravation of discs. Okay.
So make the lumbar strong.
Essentially, yes. So I will show you some stability exercises once we improve the symptoms a little bit down here. Okay. And that will decrease the likelihood of this happening again, which is essentially synonymous to quote unquote curing at that point. Okay. Yeah. Now, don't get me wrong. Because you have had episodes of low back pain, the most likely indicator that a person will have low back pain is a previous history of it. Okay? So you will always be predisposed to getting additional disc injuries. But we can take steps that unfortunately we didn't get around to last time to decrease that likelihood significantly. Okay? And fortunately, they're all through exercise, which you love to do.
Yes.
All right. So we've established that Kanav does have some nerve root tension issues along that right lower limb. So a good exercise to do anytime you are experiencing any kind of hint of those sciatic pains is something known as nerve root flossing. Okay? Have you heard of this before? Did I explain this to you beforehand? No. Okay, well, you're going to learn today. So nerve flossing, if you think about it, well, actually, sorry, where am I going with this? Nerve flossing, our nerves are actually only two long. Okay, what do I mean by that? When I say, okay, we got nerves in our baby toes down here, it is one nerve, one long, well, multiple fibers, but one long chain that goes from there all the way up into our spine, and then from our spine up into our brain. It's just two connections, two nerves there, okay? One long wire. So when we say nerve flossing, it is quite similar to flossing one's teeth to try to clear up any obstructions that are present there, okay? So what does that look like? Well, we're going to start in this seated position, okay? And we're going to use our right leg because you're experiencing some sort of tension on that right side, okay? So you're going to start with your head down, looking towards the floor, and just watch me for now, and then I'll watch you do it. Now, you're going to start to straighten out that right leg. Simultaneously, as you bring this leg up, you're going to look up towards the ceiling, okay, as far as you can, and then you're going to go back down. If you think about it, it's a little bit like pulling, flossing this way, flossing that way, flossing this way, flossing that way. In somebody who doesn't have nerve root tension, this shouldn't really feel like anything. And also in people who only have mild cases, okay? You might feel a little bit of a pull somewhere along the chain, but doing this is going to help clear up any adhesions or restrictions that are forming. So do you want to give that a try now in that position there? Are you able to slide back so your feet are kind of dangling there?
Dangling, it's not gonna dangle.
Yeah, you're really tall. You know, why don't you sit here? Sit right there. We're gonna switch roles. I'm gonna sit in the comfy chair. There we go. And you're gonna slide further back. Perfect. And now I want you to try that movement. So you're gonna look down towards the ground. Yep. And then you're gonna bring the leg up while simultaneously bringing the head back. And okay, so we're getting a little bit of shakiness. Are we getting symptoms as we do that? Yeah. So you feel some
like my muscles are stretching all over my thigh.
Okay. But are you getting that shooting pain down the leg? No? Okay. Then we're okay to keep doing this. Yeah, let's go once again, okay? Okay, nice. So we're going to bring this up, look the head back at the same time. Very good. Okay, and then slowly back down. Okay, so you feel your muscles working there, but you're not getting that shooting pain. Good. Then this is something I'm also going to want you to do regularly throughout the day, okay? This is kind of like a stretch, if you can stretch nerves, and you can't really do it too much. So if you want a number, I'd say maybe do it 20 times, 2 times a day every day.
Sounds good.
I'll send these to you so you don't forget. But again, mobilizing that nerve will help clear up any kind of restrictions that are forming along that nerve, adhesions with soft tissues and whatnot. Okay, good.
Yeah, it kind of relaxes a lot.
I hope so. Kanav, how did you find all of that?
Again, it is amazing, and I first of all I trust in my doctor, and then I trust in the process. That's why it took me a lot of months to get it to the worst. So I think it's gonna take me a couple of sessions to get me to the where I want to be. But I feel really positive, and I feel very positive about the fact that I'm gonna get cured.
I love to hear that. Love to hear that. So a big part of what any healthcare practitioner should do is educate and reassure when appropriate. Obviously, you don't want to reassure somebody if what you're saying is a blatant lie. But in this case, we've got a little bit of a disc herniation. Yes, we've got a little bit of neurological involvement on tests when we are looking for that. But we're not seeing any serious, drastic impairments, which is a good thing, okay? So again, Kanav was kind of told that, oh, you're gonna need injections, you're gonna need surgery. Maybe, okay? I think only 3 to 5% of disc herniations actually go that surgical route. The bulk of them get better on their own, okay? And even the ones who require a little bit more intervention, well, that's what people like chiropractors and physiotherapists and massage therapists are for. So we've gotten it under control before. We're going to get it under control again. And then importantly, we're going to hopefully keep you around long enough to teach you how to actually increase your core stability and decrease the likelihood of this happening again. All right. Now, do you have any other questions for me for today? I'm happy to answer anything you got.
Just again, the nerve flossing we did on the right leg. Before, when I was waking up from there and coming to sit over here, I was feeling a lot of my nerve was paining, I felt it tingling, right? And now after I did that exercise, it's not like
it's not. So when you were coming to this chair,
instant,
it was fine. I no, there was pain, but then you did the flossing, and there was none when you were transitioning.
And now when I'm sitting over here, there's no tingling.
Perfect. Okay, so that's actually phenomenal if that's the case. So again, a little bit of movement can really help these things when we're dealing with small structures. Even getting an extra millimeter of space or movement in there is gonna be complete night or day difference. So really happy that's the case with you. Absolutely, we're gonna include both that and the McKenzie protocol going forward, and I think we're looking at a great prognosis. Okay.
Awesome.
Any other questions?
I am perfectly fine.
All right. Well, then, thank you so much for coming in,
Doctor.
Really appreciate seeing you again.
Thank you. Don't forget to like, comment, and subscribe.
Thank you, Kanav.